Hi, this is Betty Long, founder and CEO of Guardian Nurses Healthcare Advocates. Welcome to Season 7 of the Lighting Your Way podcast, a season in which I continue to talk with my Guardian Nurses colleagues and hear from them about their day-to-day support of our patients and clients. Their stories are heart-wrenching, uplifting, empowering, frightening, captivating, and true. Welcome to Season 7. Regardless of the healthcare issue, we often encourage patients to follow their instinct, or more commonly known as trusting their gut. In this episode, my colleague Crystal Leonardi shares a story that proves that it doesn't matter how old you are to follow that advice. Crystal Leonardi, welcome to the Lighting Your Way podcast. You are our final Season 7 guest. So it's good to get you. Yay, woohoo. It's good to get you on finally. You are the solo nurse supporting the Ironworkers Union Local 11. How long has that been that you've been there?
I have been with Ironworkers Local 11 going on a little over 2.5 years.
Wow.
So time has been flying. It feels like yesterday, but I definitely have made a lot of headway with Local 11.
Yes, you certainly have. And that is a tough crowd, as they say, tough crowd.
I would say tough, but once you get to know them, they're a really good group of people.
Yeah, they might be iron workers, but they're softies inside, right?
Yes, they are. Yes.
Okay.
And they are very appreciative for all, the work that, I help them with and kind of navigate them. So I have many that still give me a call after retirement. So I know that, I've done, my job with them that way.
Yeah, you've definitely made a difference.
I have, and I'm happy, that I get to do this.
And so am I. Tell us a little bit about the membership or about Local 11. Where are they located? Where the members live and stuff?
So my members are throughout New Jersey. And also we have members in Pennsylvania. And I also have some guys up in New York. So they're, scattered throughout the tri-state area. I have about 3,300 members, or we call them belly buttons, and they, just are throughout, the tri-state area.
Yeah. So 3,300 belly buttons, and we count that as their dependents and the members. But there are men and women in the ironworkers, aren't there? As workers. Yeah.
There are both men and women. And they, I would say there's a good amount of women that do work throughout the ironworkers that I've come in contact with and, interacted with. So it's a strong group of people. And they are a tough crowd, but once you get to know them and build the trust with them, they are a good set of people to, get to know.
Yeah. As with most of our building trades clients, right? They work hard physically too. They work really hard. They beat up their bodies. But they try, they love having a nurse to support them. And you've certainly done a great job up there getting their trust. So kudos to you.
Yes, that's the tough part, just trying to get myself known throughout the ironworker world, and just, introducing Guardian nurses to them and letting them know about, this great benefit that they have with the ironworkers.
Yeah.
When I first started, a lot of them didn't know. So I became, as I became, more familiar with my role and ironworkers, I've, gotten to learn the ins and outs of, their world.
Have you ever had the chance to go on a job site to promote the service?
I actually have. I had a member that getting appointments for them are tough. So, not having, internet services down at work sites, I met, an iron worker down at his job site, and I was able, I was poured around the entire site. So it was nice to see people that, I would be introduced, hey, this is Crystal, the nurse with iron workers, and oh, I've talked to you, and I've talked to you. So it was nice to actually see what they do instead of hearing it,
Yeah,
being there firsthand.
I bet. Did you have to wear a hard hat?
I did. And I got a vest.
Did we get a picture of that?
I think we did.
That's
So, I
great.
mean, it was interesting. I mean, just to, see the job site itself, everything it entails. And, it's a hazardous condition.
Yeah,
So,
yeah.
kind of navigating through that. It was actually a fun experience to, see their world firsthand.
Wow. Well, tell me about the job sites. Like, what kind of, like when I went up to the training center uh, in North Jersey, they have steel girders in the training room, not that high. I think they're only 15 feet, with netting underneath it, which made me laugh because and I think Bill at the time said, "You want to get up on the girder?" I'm like, "No, no, thanks." But what kind of? I mean, you think about the iconic picture from I think it's the 1920s, where all those iron workers are sitting having lunch on the iron beam up above Manhattan.
Oh, yes, yes, yes.
They're not
Um,
they're not tethered onto anything. They're just up there. What kind of like that's my impression of what the iron workers do is what is the steel girder and building a building. Is that true? Do they have other responsibilities as well?
they do. I mean, the site that I had visited was, they were putting up it was for the Port Authority, New York City Transit. So they were doing like the overhead, structural bridges for that, for the tracks. Um,
Oh, okay.
a lot of them are also, deep into the ground, putting, structural steel rods in. So it all varies. I have, members that are working on bridges. I have members that are working, on roadways, buildings.
Okay.
We also have members doing the new football stadium in Buffalo, New York.
Oh.
So it makes up a lot of different, they just don't do one thing.
Yeah, I mean, like I said, I only thought about the buildings, but thinking about a stadium or roads and bridges, I guess, hopefully everything is built with iron and steel. So
We
they're
also
they're go ahead.
we also have members working on schools. They work on, I know some of the guys are working, they do most of the work at night if they're reinforcing, buildings. So that is, it's all different examples of what, iron workers do. Hospitals. So they're all over.
So their work with all this building and iron, I mean, it's got to impact and affect their bodies. Like, what kind of things do you what are the top type of things that you see for the members?
We see, a lot of musculoskeletal, conditions,
Yeah.
ranging from shoulders to back to knees. Um, that makes up a lot of their bodies take a hard beating just because of the type of work that they do. They, are holding, their belts sometimes weigh, they can weigh 50 pounds and they're, carrying
Wow.
that around on top of their weight. They
Wow.
also, between, moving, they have equipment that moves the steel beams, but they also have to support it. So the machine's not doing everything. So they
Wow.
have, shoulder issues, they're lifting. I have the welders, they're kneeling. So, it's very tough on their bodies.
Wow.
And we see it like later on,
Yeah. Yeah.
as they're nearing like the retirement age is when, you start to
Sure.
see, those type of, injuries that,
Yeah.
happen, or just wear and tear on their bodies.
Yeah. The apprentices, I mean, obviously they're younger, I'm going to assume, but how
Yeah.
long is their training?
Their training, I actually had the pleasure of meeting a lot of the apprentices. During their course, I met with the first and third year, and presented the Guardian Nurse program. And then I also met with the second year apprentices. So they're in for 4 years before they are,
Wow.
out of the whole entire program. So it's very labor intensive. They actually work and then they go to school at night. So they work all day and then they go to school for 3 hours in the evening.
Wow. Wow.
So it's labor intensive.
I didn't realize they were working during the day. So that, but on the
Yes.
job site, right? Just helping
Yes.
out, doing things. Okay.
Yes. Mm-hmm.
Wow. Wow. Could you imagine if we had in nursing school, if we had to work on the floors and then go to school? Wow.
I know it's tough, and that's the biggest obstacle of trying to be able to make sure that they get follow-up appointments, because they do work, and it's trying
Wow.
to find that balance of when we can help get them seen. That's probably my biggest feat for them, is trying to get them care outside of hours.
So
That they're not working.
a lot of our building trades, when we've talked to the nurses who support them, they don't have time off. So if they take time off, they don't get
No.
paid. Is that true at Ironworkers?
That is true. And if it rains, they usually wait on the job, and then if it winds up getting canceled, then they wind up going home. So it's either kind of trying to predict the weather if they're off from this job, waiting for a new job. So it's kind of like a fine balance, trying to find that right spot to get them in for an appointment. So it could be last minute. It could be off for the next few weeks because that job is done. So it's just kind of navigating it, and just kind of, their schedule varies. So just kind of trying to meet them where they're at.
Wow. Wow, that is a challenge, especially if you're trying to predict the weather. I had no idea that you wouldn't want someone on a iron beam in the rain with a welding trying to weld something. So with all of that, right, with all of the challenges that you have, and them, both for them and for you in terms of the healthcare system, is there a particularly compelling story that you would want to share?
I do have a story. Aside from my everyday, musculoskeletal, appointments, I actually had an iron worker reach out about, one of the members of his family. She was a young, newly diagnosed, diabetic. So it could range, from diabetes to musculoskeletal. So I deal with, all different health conditions. This happened to be his daughter that he had reached out to. And she was initially diagnosed. She's 20 years old and was diagnosed a year prior. And we worked, together. She had, the family had reached out, and I worked with both the mom and the dad and the daughter, trying to get her to understand her new diagnosis. She came in with a very high A1C, which was at 11.2. We worked a long time to get her, understanding her diabetes, understanding diet, getting her the right medication she needed, getting her in, her pump. And all the while doing this, she winded up developing, because of the diabetes, an elevated protein in her urine. And this was a few months later. So, she's going along, living, her life, and just kind of adjusting to everything. And, we got her A1C down, which was great. Almost a year later, down to 6.5. So she was doing, she was doing really well. So we had tackled that together. And, with the young ones, it's like constant communication, constant education, just trying to get her to maintain her follow-ups, make modifications in her lifestyle that actually, fitting diabetes into her lifestyle, not changing her lifestyle. So,
Okay.
that was a big thing for us. So, we worked with that. The protein in the urine was there, and, the doctors felt that it was more likely related to the diabetes, but she had one isolated protein high a few years ago, and the doctors now wanted to do a renal biopsy.
Why? What? Because of the
protein in the
care?
urine. The doctor wanted to see if it was related to her diabetes, which we all know it can be a cause of protein in the urine when it's uncontrolled. So with that information, she had called me in a panic that they wanted to do a renal biopsy. She didn't want to do it. She asked if I could meet her at the next appointment, which I said, of course, we'll sit down and talk with the doctor. We sat down, and I asked actually if we could do ultrasounds. We had a conversation with the doctor back and forth, trying to see if there were other causes, that other reasons that we could, check into before jumping to such a procedure. She's a college student. She works full time. She's working, many hours, and just trying to see if it was truly necessary. So, we spoke about a renal ultrasound, and if that was normal, if we could order other blood work that could see if there were any other contributing factors that would necessarily say that it was caused by this. So
Right.
With the doctor's help, obviously, we discussed it. We went back and forth between the pros and the cons. And, really it's just trying to, optimize the management of, her diabetes, and which we had. So we knew there was a big change. And we asked, urine, can we do follow-ups? So we did follow-ups I think we did it it started in November. We did again in January and February and March. And in those months, we saw a trend of the protein in her urine going down. So with this information, the doctor was asked to say, okay, we're seeing this, decrease. How about we order additional tests to see if there are any autoimmune, anything contributing to this, which they did. We waited again a month. These blood works all came back negative. And at our follow-up in May, we went in and there was no more protein in her urine. So
wow.
With that, she did not undergo the scan, and we were both ecstatic.
Yeah, I bet.
It was something that she was scared of. I mean, and something in I don't know if it's my nurse instinct or my mom instinct, because she's 20 years old. It just didn't seem to justify it at that point. And I knew the doctors were concerned about her kidney function, and but all the testing showed that there was nothing there to be concerned. So why put her through this unnecessary procedure without having all the facts in front of us?
Amen.
So that was
sister.
really,
Amen.
our, my gut feeling for her, and just advocating for her, because she was scared, and it was something she did not want to do. So it was, between working with the doctor, speaking with her mom, her parents were involved, just kind of advocating and just stepping up and saying, hey, is there something else we can do, without doing this unnecessary procedure? If it's necessary, she had agreed. If any of the testing had come back positive, she said, okay, I'm all in. But by doing all this testing, we were able to see that there was no other contributing factors. And the last visit, there was no protein in her urine. So,
Wow. So the kidney biopsy or the renal biopsy, as you said, the kidney biopsy is invasive, right?
yeah.
It's not easy. It's a little scary and potentially risky, honestly, when you're poking something inside. Is that what her fear was, just to have something invasive?
That was her fear. It was the fact that, this was an invasive procedure that
Yeah.
not only, there are risks associated with it. And, if you don't need something, why go through that?
Right.
There could be potential complications. She was
Right.
scared. She's a college student. She barely has time to, take off from school. It was
Right.
all these factors that led up to it. And she's been working really hard with her diabetes. She's really has made significant changes. And we saw it in the numbers. And we
Right.
even got the endocrinologist. We even, spoke with the endocrinologist and said, do you feel that this could have been related to the diabetes? And, the doctor agreed. And it was a team approach because we did have both doctors speak. So, and,
Right.
being there to speak about it, I'm not sure if she would have did the procedure or if I was not there. I don't know
Right.
if she would have, per se did the follow-up necessary. I don't think she would have known to ask these questions.
I don't think so either. And that's what I was going to ask you. Like, without your support, she may have eventually accepted to go into for the biopsy, or she may have said, forget it, and never gone back to a doctor again. Right? Like that's the other
Yes,
option.
yes,
Wow.
yes.
Yeah.
It would have been, it would have been the just let me see how it goes,
Right.
and
Right.
not ask those questions.
Right.
Because initially she had said, I don't want to have it, but, I didn't want her not to do it if it was necessary, then by all means, we spoke about it.
Yep.
If
Yep.
we wanted to make sure that this was 100% necessary at this point in time.
Yeah, sure. As with any test, right? You want to make sure that it's useful information, and have we done all the other things that could lead to an invasive test? I think that's a
Yes,
great strategy. So when you think about, I'm sure you've had other cases like that. They may not be 20 years old, but I think that
yes,
the healthcare system sometimes, right, we just want the information and we'll just suggest the test without really stopping and looking at the whole landscape, as you did, and made the renal doctor stop and kind of think about it and discuss it, which is good, right? I mean, it wasn't an urgent
yes.
situation. You had
It was
time. You
not.
had the
We had
right.
time. And time
Yeah.
was on our side. And not time isn't always on our side, but at this time, it was. And, in other cases with many of my other members, we sit back and, they call me for, healthcare advice. Should I do this now? There are certain things
Right.
that have to be taken care of right away. And there are certain things that,
Right.
could potentially wait. And we talk about that and we, see what needs to be done first. And I think that's a
Yeah.
big part of, assessing our patients, seeing what's a priority first.
Yeah, sure. And I think that's one of the values of having you there, or having a nurse there, as we do with all of our programs, is to talk it through and present options and guide them. Right? You're not making any
Yeah.
decisions. You're just presenting. Or hold on, let's
No,
look at
I'm
the whole.
supporting their decisions,
Right. Right.
supporting what, their decisions that they want to make and giving them the options of things that, they wouldn't know necessarily to ask or who to see. I get those calls all the time,
Yeah.
it's
Right.
maybe they know what to do, but did you do this or did you do that? Oh, I didn't
Right.
think of that. So,
Right.
having that second, that person to reach out to can be helpful.
Absolutely, absolutely. So what's the lesson, right, for our listeners from this story, do you think?
The lesson is that you just need to, advocate for yourself and, know about your treatment or your condition, and learn everything about it. Ask the questions, and be able to, not be afraid to ask those questions to the doctors about your health care. If you don't know, they don't know that you don't know that. So it's best to ask about your health. No question is a silly question. And, to them, it's your health. And you want to make sure that, you're getting the right care that you need.
Yep. Yeah, I think that advocate for yourself, although it's a big hurdle for a lot of folks because they're intimidated potentially by the healthcare system, as it can be intimidating. But I think that really, if you're entering the healthcare system without a guardian nurse, you really do have to be on your best game and ask questions, like you said. Ask questions, right? Don't be afraid to ask questions. Don't be afraid to say, I don't understand the answer. Explain it again, right? Just advocate for yourself, which is a great message all around. So thank you, Crystal. Thank you for your good work.
Thank you.
And
lastly, I would just say one last thing. If something doesn't feel right, then listen, then listen to your body and just, continue to ask those questions and advocate for yourself. No one knows, yourself better than you.
That is a great last point. Thank you. I appreciate that. All right. Well, thank you again for joining me. I appreciate it. I think it was a good conversation, and those iron workers are lucky to have you.
Thank you so much.
Okay. Take care.
Bye, Betty.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.